guys, it's Khaki. Today I wanted to talk to you about something that I get asked a lot by my patients and by other people who are kind of dipping their toes exploring bariatric surgery. What qualifies you for bariatric surgery? Who is it meant for? Let's talk about it. Recently, I say recently, within the last couple of years, the ASMBS, which is the American Society of Bariatric and Metabolic Surgeons, have changed their recommendations of just who bariatric surgery is for. Previous to these changes, bariatric surgery was recommended for people with a BMI of 35 to 40 if they had at least one weight related comorbidity. That could be sleep apnea, hypertension, diabetes, osteoarthritis of their knees, anything that could either be caused by or worsened by obesity. Over 40 BMI, you didn't have to have a comorbidity. You automatically qualified. Well, within the last couple of years, the ASMBS has changed that. So now, folks with a BMI of 30 to 35 with diabetes are strongly recommended for bariatric surgery. A BMI of 30 to 35 with at least one weight related comorbidity, as we discussed previously, those are recommended for bariatric surgery, and those with a BMI of 30 to 35 who have tried and failed to lose weight in a non surgical way or who have lost weight but could not sustain that weight loss are recommended. Incidentally, people with a BMI of at least 25 who fall into the Asian population are actually recommended for bariatric surgery because folks of Asian descent with a BMI of at least 25 are much more likely to sustain or to be stricken with, for lack of a better term, weight related comorbidities. They get the hypertension, the diabetes, things like that at a much lower weight than those who fall into other populations. At 35 BMI, even without a comorbidity now, there is a recommendation for bariatric surgery from the ASMBS. Why did that change? Well, the strong recommendation for diabetes at a BMI of 35 or a BMI of 30 now and not at 35 is because of the scientific evidence that weight related bariatric surgery has a great chance of putting diabetes into remission without medication. I wrote down the numbers so that I could tell this correctly. Between different studies, so we're going to have a wide range, but between 48 and 90% of diabetics achieve remission from their diabetes at 1 year post-op. Compare that to 39% without bariatric surgery on just medication alone at 1 year post-treatment. That's a huge number. That all of the complications, I tell my patients, if you have to have an illness or a disease, diabetes is a good one to have because if you stay on top of it, if you manage it, you can prevent all of those consequences. But it is hard to manage. It is hard to put it into remission. So having that tool of weight loss surgery makes you much more likely to go into remission with type 2 diabetes. Hypertension, 50%. 50% after 1 year are off all medications, and it is considered to be in remission. The change, I must say, recommendation by ASMBS does not mean coverage. Unfortunately, coverage by insurance companies may lag behind. They may still go by those old guidelines, or worst case scenario, you may have an exemption on your policy for bariatric surgery. Knowing these guidelines, knowing what the most powerful group of physicians, of surgeons, of weight loss medical people recommend is a great tool when you are dealing with your insurance company. When you go to a bariatric surgeon and you have a BMI of 33 and type 2 diabetes, and they tell you, yes, the ASMBS recommends this. I think this can get you in remission. Now is the time. And they file paperwork with your insurance and it gets denied because you don't reach that 35. You need to write a letter to your insurance company and quote those guidelines. Actually, this is why it's now recommended, and I have this chance of remission from my diabetes now if I have this surgery. Another reason that the guidelines have been lowered is encouraging people not to wait on a truly life-saving treatment. Why would you wait? It's like cancer. Obesity can lead to life-threatening consequences. Why would you wait until you have those consequences before you act upon it? So surgery is recommended much earlier now. I wanted to talk about that because, like I said, I get questions all the time. People, unfortunately, watch shows like My 600-Pound Life and don't see themselves in those people in those shows. You may have a BMI of 40 and can still function perfectly fine in society, but you still qualify for bariatric surgery, and it's recommended for most of those people. So don't think that it's for somebody else. A vast, vast majority of people in America and in most Western countries fit those guidelines. Guys, I would love to hear any questions that you would have. I would love to hear, did you have a problem qualifying for bariatric surgery? Did you have a problem getting your insurance to cover bariatric surgery? What did you have to do to qualify for your insurance company? I would love to hear where you're at in your journey, any questions you've got, any problems that you're having. I would love to hear video suggestions. I want to talk about what you want to hear about, what really matters to you. Also, I do want to say I had a birthday last weekend. I went to Knoxville with the girls from my office, and we had a fabulous time. I was able to look back at videos or at photos from my last birthday before I had gastric bypass. I'm going to put up some pictures at the end of this video, a comparison. It's so different, not just in the way I look. Of course, I look different, but it is so different in the way that I feel, the way that I'm able to move around, all the things that I can do now, all the medicine I don't have to take anymore. It's amazing. And I hope that people realize what a difference bariatric surgery can make in your life, and that you do qualify a lot sooner than most people think they do. I hope everybody has a great week, and I will talk to you next Wednesday. Bye.